Hello, Dr. Maria. Let's talk about these myths around the acne.
Yeah.
So, do tell me that we know acne is more common in adults, and a lot of our adults are quite frequent on their mobiles. Let's burst these myths. Do food have a role in acne? I mean, because of food, can people get acne?
Yeah. So there is a small role of food in acne, like high glycemic sugars, sugary
Diet,
foods.
yeah, high glycemic diet.
So most of those high glycemic diet can affect a little bit to an extent.
Okay.
It's not that everyone will be affected by it, but a little bit of processed food definitely will also affect. But it's not just if you have junk food, you'll have all the acne. It's not if you have oily food, you'll get oil on your face. That is not.
So that's true. So what is actually your, as you rightly said, it's not, it's a hormonal. It's the acne are because of genetic, the hereditary, the hormone, and food has very limited role. And you're right. Just high glycemic diets, maybe the milk do have, dairy products sometimes do have, but not necessarily.
Yes.
Now the another problem with the young generation is that they get influenced by some influencers which are not dermats and all, and use all as products. What do you suggest them?
So that is an absolute no. Definitely your skin is not a playground where you try and test everything. It's not every time. It should be a personalized and one-to-one. Definitely. You should meet your dermatologist, get a proper consultation and diagnose what kind of acne you have. Maybe few people may not be even having acne as of. It might be something
different. Correct.
Everything on the face, they'll think it's pimple. It may not be even pimple. So every time the treatment should always be personalized, in my opinion.
So rightly said, like we do have acne and a lot of people do get influenced by those influencers who are not the specialists in treating the acne. It's good to consult your dermatologist. Okay. Now the other thing about the acne is that people think that those pigmentations do happen, and we know that it's sometimes because of the acne. Do you recommend treating the pigmentations along with acne, or it's good to first treat the acne?
Definitely, there can be two takes on that. If the acne is too much and the inflammatory part of the acne is too much, definitely we need to treat the cause of the pigmentation, that is the acne itself.
Correct.
So once the acne treatment is going on, and later on if the acne subsides, side by side we can start with topical agents for pigmentation, and combination treatments also we can add.
So one more thing is that, Maria, what is the role of lasers? Because many clinics or many doctors, or they go to some people who, we rightly said, are not the dermatologist, they jump immediately into the lasers.
Yes.
So do you think that we should first treat acne? What is the role of lasers in treating these acne?
So lasers as such, for acne scars, definitely that is the standard gold standard of acne scar. But for acne, one laser would be pico laser or Q-switch laser, which has got an acne mode, which will reduce the sebaceous gland
activity.
Activity.
But for the scars, it
definitely
is later on. First we need to treat the acne
first,
and then and only then we can go to the scar and use fractional lasers and
yes,
whatnot.
Definitely.
Thank you very much. Quite informative.
Yes,
and thank you once
again.
Thank you,
sir.